So I was experiencing a lot of pain just right along this area, my left molar. I thought there must be something wrong with maybe the root canal, or maybe I fractured or chipped the tooth because the pain wasn't going away. So initially I went to the general dentist, and he saw that there was a big problem with the root canal that had failed. He recommended actually seeing an oral surgeon to have the tooth corrected and have an implant placed.
He had seen his dentist for tooth pain, and his dentist had then diagnosed him with a non-restorable tooth. He had a root canal that had failed and was non-restorable.
So after he told me that I would need the implant, I asked him a lot of questions about, okay, so what's next? What do I do now? How long is it going to take? Is it going to hurt? Do I have anesthesia for some of these things? And so he went step by step through the process at that time. And by the end of it, he had it all laid out for me about the different steps and about how much it would cost and the time commitment in between each step.
I highly recommend dental implants in most cases of tooth loss. You're able to floss and brush around these dental implants like natural teeth, and you're able to chew and smile around these dental implants. So people are very impressed on how these dental implants are able to provide quality of life for them.
I knew I wanted to have an OMS do my procedure because in this situation, I want to make sure that who's doing the procedure is the one that has the most expertise in this area. And that if something goes wrong, then they'll know how to fix it. And it's a lot about confidence in who's giving you that care. And I think it's always best to seek the person that has that best experience.
An oral and maxillofacial surgeon has many skills involved with dental implant placing, not only with the surgical technique, but also with our ability to perform sedation and anesthesia to help patients cope with some of the anxieties that are associated with surgical procedures, such as a dental implant.
For someone who's looking for a quick and cheap, easy way of fixing a problem, usually there's some problem with that whole process. Ultimately, the cost will pay off itself. If they have good care, this tooth lasts, and it looks great, that's the most important thing.
Dental implants, while in some cases costly, do provide a very long-term solution for tooth loss for these patients. The return on investment for dental implants is pretty significant for most patients.
It's been a great experience overall. I'm very happy with it.